Imagine a time when the world was grappling with a mysterious and devastating illness, a disease that baffled the brightest medical minds. Now, picture a group of nurses from a country many in the West consider developing, stepping up to lead a groundbreaking medical discovery. This isn't a Hollywood movie script. This is the incredible true story of Malaysian nurses and the Nipah virus outbreak. The year is 1998. In the pig farms of Perak, Malaysia, a strange illness begins to surface. It starts with flu-like symptoms, fever, headaches, muscle pain, but quickly escalates to encephalitis, a severe inflammation of the brain, leading to comas and, tragically, a high mortality rate. Farmers and their families are falling ill, and panic is spreading like wildfire. Initially, it's mistaken for Japanese encephalitis, a common mosquito-borne virus in the region. But something is off. The preventative measures for GI, like fogging to kill mosquitoes, aren't working. The disease continues to spread, and the death toll keeps rising. The local healthcare system is pushed to its absolute limits. This is where our story truly begins, not in a high-tech lab, but in the chaotic, overcrowded wards of local Malaysian hospitals. In the middle of this crisis are the nurses. At the time, there was a prevalent, though often unspoken, stereotype. Many from Western countries perceived healthcare professionals from places like Malaysia as lacking modern training or being less equipped than their counterparts. They were seen as followers, not leaders, assistants, not innovators. But this crisis would shatter that perception in the most dramatic way possible. The nurses on the front lines were the first to notice the strange patterns that doctors, overwhelmed with the sheer volume of patients, were missing. They were the ones spending hours at the bedside, observing, talking to families, and meticulously recording every detail. They noticed that this wasn't just affecting people in one area. It was spreading among pig farmers who had close contact with their animals. More importantly, they observed something crucial. The disease seemed to be transmitted from person to person, particularly among family members and healthcare workers caring for the sick. This was a terrifying realization because it meant this wasn't just a localized animal-to-human problem. It had the potential to become a full-blown human epidemic. These nurses started implementing stricter infection control measures long before official protocols were established. They insisted on wearing gloves, masks, and gowns, even when supplies were short. They segregated patients showing neurological symptoms. They meticulously tracked patient contacts, essentially performing grassroots epidemiology. They were creating the playbook on how to handle this new disease in real time. Think about the courage that took. In the face of an unknown killer, with no clear guidance from the top, they relied on their training, their instincts, and their profound dedication to their patients. Their detailed notes and direct observations were absolutely critical. When international experts, including teams from the U.S. Centers for Disease Control, finally arrived, they were expecting to lead the investigation from scratch. Instead, they were presented with a treasure trove of data meticulously collected by the Malaysian nurses and doctors. The nurses' observations about the close contact between patients and pigs, and the subsequent human-to-human transmission were the key puzzle pieces that had been missing. This information guided the researchers. Dr. Chua Ka Bing, a Malaysian virologist, was working tirelessly to isolate the pathogen. Using samples from patients and guided by the clinical patterns observed by the frontline nurses, he was able to isolate a new virus from the family Paramyxoviridae. He named it the Nipah virus, after the village Kampung Sungai Nipah, where it was first identified. This was a monumental breakthrough. It wasn't Japanese encephalitis. It was a completely new, deadly pathogen. The discovery of the Nipah virus confirmed what the nurses had suspected all along. The primary route of transmission was from infected pigs to humans. The subsequent human-to-human cases were happening through close contact with infected individuals' bodily fluids. The Malaysian government, armed with this definitive information, took drastic and difficult action. A massive culling of over 1 million pigs was ordered to eliminate the animal reservoir of the virus. It was a devastating economic blow to the community, but it was the decisive move that stopped the outbreak in its tracks. The crisis was contained. The world had a new virus to study and a new respect for the Malaysian healthcare system. The nurses, who were once underestimated, had proven themselves to be not just caregivers, but sharp investigators and public health pioneers. Their meticulous work, their bravery, and their refusal to back down in the face of the unknown were instrumental in solving the Nipah mystery. They didn't just follow protocols, they created them. They didn't just assist doctors, they guided the entire medical investigation. This story serves as a powerful reminder that expertise and innovation are unconfined to wealthy nations or famous institutions. Brilliance can be found anywhere, especially on the front lines where real-world challenges demand real-world solutions. The Nipah outbreak was a tragedy, but it was also a moment of triumph for a group of unsung heroes. It rewrote the narrative about what it means to be a nurse and showcased the incredible skill and dedication of Malaysia's healthcare professionals to the entire world. They weren't just good enough, they were world-class. And they proved it by leading a medical breakthrough that saved countless lives. Thank you so much for watching. If you found this story as inspiring as I did, please hit that like button, subscribe for more incredible true stories, and share this video to honor the legacy of these amazing nurses. See you in the next one.